The federal government has warned that Nigeria's worsening malnutrition crisis, marked by undernutrition, overnutrition, and hidden hunger, is undermining the health, productivity, and economic potential of millions of citizens, especially women and children. Permanent Secretary of the Federal Ministry of Health and Social Welfare, Kachollom Daju, speaking at the Nigerian Health Watch Roundtable on fortifying Nigeria's future, strengthening nutrition through local solutions, stressed the need to boost public and SME awareness on fortified foods. Our correspondent has the details on this report.
According to the 2024 Nigeria Demographic and Health Survey, 40% of children under 5 are stunted, 8% wasted, and 27% underweight. Deficiencies in vitamin A, zinc, and iron remain widespread, especially amongst children, adolescents, and women of reproductive age. Premixes, essential blends of vitamins and minerals added to staple foods could help close these gaps. But experts warn that unless they are locally manufactured, Nigeria will remain dependent on costly imports. Speaking at the roundtable discussion, the Permanent Secretary, Federal Ministry of Health and Social Welfare, represented by Ladidi Bako Ayegusi, noted that while Nigeria has achieved 95% coverage in salt iodization and satisfactory fortification levels in flour, sugar, and vegetable oil, compliance amongst MSMEs remains weak due to high costs, low awareness, and poor access to affordable premixes.
When we are producing locally the premixes that we need for food fortification, the cost will reduce. One of the recommendations that will result from today's discussion at today's roundtable would be, how do we accelerate the capacity building for the premix producers so that going forward Nigeria will be producing locally the premises that we need for food fortification. So in the Federal Ministry of Health, the government is doing all it can to ensure that we ease there is ease of doing business.
The Managing Director of Nigeria Health Watch, Vivian Ihekwazu, represented by Safia Shuaibu Isa, emphasized that Nigeria cannot continue depending entirely on imported premixes after 20 years of implementation.
To truly safeguard the nutrition and health of our people, we must strengthen local solutions. From building domestic premix production capacity to supporting MSMEs and ensuring stronger enforcement of fortification standards. This is precisely why the roundtable is so important. Today, we gather as government leaders, private sector actors, civil society, and development partners to chart practicable, sustainable pathways. Together, we'll explore opportunities to unlock investments, leverage innovation, and foster partnerships that can transform our fortification ecosystem and ultimately save lives.
On the regulatory side, Deputy Director of Food Safety at NAFDAC, Anya Mofelicitas, explained that the agency does not register staple food products that are not fortified and continues to conduct monitoring to ensure compliance.
SMEs, they need to go for capacity building, how test the premises to be ensured that they are using the right premises. But for NAFDAC, for instance, we have decentralized registration of MSMEs. So we have NAFDAC office in all the 36 states in the country. So the MSMEs NAFDAC is available for them or in all the states, so they can have access to NAFDAC for guidance and for proper registration process.
Experts at the roundtable stressed that Nigeria must urgently establish domestic premix manufacturing plants and provide tax holidays, reduced tariffs, and credit support to strengthen local producers.
All the stakeholders are ready to do the right thing. Everyone is ready to put in efforts to ensure that we have effective fortification program. Some of the things that we have had here, which I'm sure every partner would also be taking forward, and every other stakeholder, One of such is the laboratory capacity building for laboratories.
They noted that food fortification remains one of Nigeria's most cost-effective strategies for combating micronutrient deficiencies while also improving public health, productivity, and resilience.
And now